said, let's welcome to the show cosmetic surgeon, Dr. James Chan.
Hello.
Hello.
Hi.
So I'm looking at your newsletter. This is a printed out, hold in your hand newsletter, and you can read it yourself online at pronounce it. I know I'm going to say it wrong.
Reviance Portland.
However I say it, it's going to be the wrong way. I promise you that.
Or drjameschan.com.
Yeah,
right?
can you get the newsletter at that as well?
Yes, you have to sign up. It gets emailed to you.
Okay, and it's awesome. So the Reviance website is Reviance.
Reviance.
Oh gosh darn it! How am I going to remember that?
French.
Rev it up.
Reviance.
Reviance.
It's got the accent over the E. Just think of that as being, it's French. It's
I'll still get it wrong. Reviance Portland.com or drjameschan.com. Easier for me to remember. But this has all sorts of, this is as the holiday edition. It has all sorts of awesome information, questions answered. It has a little link to us. I appreciate that very much. A question and answer section. It's very, very good. So if you are interested in that and would like it emailed to you, then just go to one of those two websites. So it's the holiday season almost. The holidays are approaching. And you don't just do surgical work at your place. You also do things that have less recovery time and are non-surgical, like fillers and face zappers and little things. So let's talk about options for looking better if you have a little time but not that much time before an event.
For all the holiday parties and all that good stuff.
If you have something coming up in the holiday season that you want to start preparing yourself for facially, beauty-wise, then when should you get started?
Yeah, so the answer is as soon as you can. The better you plan, the better and the more options you'll have for treatment. So for example, if you have more than 2 weeks, pretty much any of the surgical procedures are open. Rhinoplasty, facelifts, neck liposuction, all those things are totally available to you. Some of the more heavy-duty laser resurfacing procedures. If you have between, say, 1 and 2 weeks, then you're looking at some of the more minor surgical procedures like eyelid surgery, lip implants, chin implants. If you're talking about under 1 week, you need to think about things that have absolutely no downtime. And what Daria is saying is true. You're talking about facials, chemical peels, things that make your skin glow and look better. Botox can work within a week. Fillers, dermal fillers. So if you want to, erase some of those fine lines and wrinkles and fill in some of those depressions or plump your lips, that's something you can consider if you have less than a week.
And when you say at least 2 weeks recovery time for something like blepharoplasty or rhinoplasty, you mean when you can go out and look fairly normal with the help of makeup. It doesn't mean that in 2 weeks you're going to look exactly how you're going to look, right? Because it's like 6 months to a year before everything is perfectly swelling down and looking as it's probably going to look from then on.
Right. You're definitely going to need some help, but you'll be presentable.
Right.
So, if you...
not a hideous monster.
Won't frighten anyone.
Right. If you have that big office party or, big family gathering, you don't want people to totally stare at you.
No.
Yeah, you'll be presentable in that time frame.
Okay, how about the bigger picture with things like getting procedures done and the age that you should ideally be to look your best throughout the years? Am I afraid? Do you understand what I'm talking about?
Absolutely. That's a real common question. In fact, that's in our newsletter too. When do I get started? I get that question almost every day. Should I start in my 20s? Should I start in my 30s? Should I wait until I'm 50? And the answer is, with all of the advances in facial plastic surgery right now and all of the new techniques and all of the tools that we have, the sooner you start, the better. A lot of the things that we have available now
because
are
then you can maintain rather than fix.
Exactly. It can be preventative. For example, when you think about Botox, if it relaxes the muscles that create those wrinkles and you never get that wrinkle, you'll never have a wrinkle to treat.
Yeah.
So why wait until you're 60? In the olden days, when surgery was all that was available, people would wait until 50s, 60s, and they would get surgery, and that was all that was available. But now things have changed. We have a lot of options that don't require a lot of downtime. They're smaller things. They're great for prevention, great for maintenance.
So can someone just walk into your office and not knowing everything that's available, because it seems to change every week?
And saying, my face, fix it.
Fix it. What can you do? Give
Fix
me
my face.
Give me a 20-point plan on what you could do to me.
Yes,
Okay,
absolutely.
okay.
And that's what we do. We customize treatment plans for patients depending on their age, depending on their budget, their, timeline in terms of recovery. Are they, do they work? Do they go to school? We take all those things into consideration. We help create a treatment plan that works.
Well, if getting started earlier rather than later is in fact your philosophy, how come when I ask you to give me a facelift right away,
You don't need
say
a facelift. There's nothing to lift.
Yeah, because you look
Explain that.
fantastic.
No,
And he
because
is
look,
That's right.
look,
an
jaw
honorable
now,
man.
jaw lifted, jaw now, jaw lifted.
no
This is a
difference.
Bill Pullman and Bridget Fonda in single
The
situation.
three of you
Honey,
know
you look fine.
Nothing. Nothing.
One of us is a doctor.
What are some things that you would typically recommend if someone comes in and they're, say, in their 20s or 30s, and they say, what can I do? And they still don't really show much signs of aging, okay?
Mm-hmm.
What would they say, I want to do something that will prevent me looking older in the future? What are the sort of things you recommend at a base level?
Yeah, so a lot of times people come in and they already start noticing some real fine lines around the eyes or the forehead. And for example, Botox is great for that. What you're doing is you're relaxing the muscles in that area, so you never create that crease or that wrinkle. So you'll never have a wrinkle.
That makes a
there.
lot of sense.
Yeah, and then
Well, it's
also,
too late for you.
Oh, way too late, people. Learn from my hideous mistakes.
That's right. and even in Portland, where we don't get a lot of sun, believe it or not, any little bit of sun exposure will give you age spots or
Yeah.
sunspots, and starting in your 20s and 30s, you can get that. So we have treatment for that as well.
And sunscreen.
Wear
Yes. If you want to look your very best, no matter what your age or what sort of thing you have coming up, check out Dr. James Chan. You can go to drjameschan.com or Reviance.
Reviance.
Oh, I did it!
See?
Did I do
Perfect.
it? What's that?
ReviancePortland.com.
Okay. .com. Thank you, Dr. Chan. Reviance. Say it right.
Thanks, Dr. Chan.
Thank you.
This is One Republic on the Buzz.